Alright, management of the test. Okay, of course, you talking about KKM punya pathway or guideline is very much depending on the availability, depending on the sebab dia nak buat guideline, dia kena buat for the whole country. So you're not talking about KL sahaja, in which many hospital available for colposcopy. You still need to take into consideration of Sabah and Sarawak, because of very wide area of coverage. Okay, so if you're talking about a GP, if you are you can refer, you have the facility, you know where to refer for colposcopy, or even you can do colposcopy in your own center kalau yang ada. Alright, the good thing is the best actually approach is to check for all HPV, high risk HPV positive. Okay, of course we don't this is advisable if you want to talking about cervical cancer screening, cervical cancer prevention, you send the DNA, HPV DNA, you send for high risk HPV DNA, HR HPV. Okay, you don't send for all strain. Of course, the cost will be more, lab akan suka lah because the cost will be more, but it's not really clinically significant, and it will cause worry or it will increase the anxiety of the patient. So the important that we want to detect is the HR HPV, or we call it also oncogenic HPV type. So please choose. Betul, when we are choosing from the lab, cakap kita nak hantar yang the oncogenic one only, yang berapa belas, 14 or 15 tu. Alright, okay, so the best approach, if you get positive of HR, any HR HPV positive, then you send for colposcopy. Alright, of course in KKM they might be they might not be able to do that. Alright, means the all positive oncogenic from KK refer to colposcopy, their colposcopy service will be overwhelmed. All right, so that's the limitation. And in some centers, colposcopy is not being done every day. Klinik pun tak cukup bilik. Okay, colposcopy pun ada chosen day, right? So depending on the situation. So that's why in KKM now they do the second triage, means those with positive yang daripada HPV self test will do pap smear first as a reflex, dia panggil reflex cytology, or dia panggil triage test. Okay, it is because actually not it is because of the availability of the colposcopy. Alright, but if you are, for example, talking about GP setting, the patient can be referred to a private hospital, for example, then high risk positive, you send straight away to colposcopy, and then in the colposcopy we will do the LBC, means the pap smear, and also the colposcopy. Then we take biopsy if high grade lesion is there by colposcopy. All right, so you need to know also a little bit on the colposcopy, because this is because you are going to counsel the patient. The patient will need to know what to be expect. All right, so colposcopy selalunya kita akan cakap, okay, bila HPV positif datang, how you counsel, tak cakap okay lah pun ada cancer ni, ada pra-cancer, you kena buat. No, kita akan cakap this is only a screening test. Not all HPV positive will get the disease, will get the CIN that we want to see. But in order for us to see whether you have CIN or not, you need to do then this is the second gate or the second test, which is colposcopy. Okay, dia akan cakap lah colposcopy ni kita examine cervix under microscope. Okay, dia tengok jelas, pun boleh tengok juga dekat TV apa semua. Okay, and then dia akan letak something to highlight the CIN, so we put acetic acid. Okay, ini bahasanya lah. So you boleh cakap dengan patient macam tu. If any suspicious area, the doctor, the over there, the colposcopist will take the biopsy to confirm. And if you have CIN, then they can treat you so that you don't have cancer. So it's like a prevention. So when you explain that, okay, so it is our own experience, my experience in the colposcopy clinic. Actually, this is being because I train in with Prof Wu, so for colposcopy, we need to have the training, or she trained us how to counsel the patients. Maybe we take about 5 minutes early before we do the procedure, or sometimes the counseling is longer than the procedure. The colposcopy may take maybe about 5 minutes. Sometimes we took 10 minutes to counsel the patient, because we want to ease their anxiety, because being sent, kalau doktor tak explain, yang refer tu tak explain, even worse, kita pernah tengok yang doktor tak panggil pun baca result. Alright, dia panggil result tu even by WhatsApp and by email only. Okay, this is your result, please go to the hospital. Okay, we afraid you have cancer, something like that. So the patient expected, kalau yang datang lah. So I believe that maybe yang we miss pun banyak. We should know our community actually. Tak ramai community kita takut, memang takut kanser, tapi ada orang takut dia dekat. Ada orang dia takut dia lari, means tak payahlah, baik tak payah tahu. So this, you need to know our community. Alright, bukan kita nak tipu, memang benda yang betul actually. So actually yang tak faham, bukannya yang tak faham is the doctor yang counsel. Okay, that's why kita nak kena educate and change the ni. So kita akan cakap, okay, you get HPV, alright, you need to do a further test because you want to detect CIN. So jangan payah cakap cancer, we have CIN because if you have CIN, because of the HPV infection causing CIN, if you have CIN, they treat you with simple procedure, they treat CIN, then it will prevent you from getting cancer later on. So sounds ni, so kita orang biasa ambil masa few minutes, because memang datang dengan muka tense, datang dengan muka risau, kita tahu dah from the beginning. So kita duduk, kita bercerita macam ni, barulah lagu, okay, kata, right? Sebaik dia datang. Okay, kalau you tak explain, even worse, tak explain, then dia akan Google lah, dia akan Google HPV, of course first word dia jumpa cervical cancer, right? So it is important to know and to enlighten your patient, alright? And in order for you to encourage them to go for the second, for the testing, alright? Okay, so another advice to the GP, especially, you should know where is the nearest colposcopy available, or the easiest way that your own clinic. So you should arrange with nearby specialists or few clinics. Of course, you should know your patient, yang ada insurance ke tak ada insurance, roughly the cost and all that. Or if this a government ni, then okay, nak refer kat mana, the government or general hospital, alright. Of course, talking about the public service, KKM ke, university hospital ke, many things also to do to improve. Okay, itu benda yang lain lah kalau nak discuss about the policy and all that. Because I've heard other hospital yang tak terima pun from GP. They say, you need to go to the KK first. The KK, FMS will decide back. So satu, you dah masa. Satu lagi, you put already you already put a barrier to the among the patient. So the patient cakap, susahnya kena ke sini. Macam tu, loss lah, hilang. To follow up, or tak payahlah buat ni, dan dia akan nasihat orang lain lah, leceh lah ni. Dan okay, anak dia tak buat, anak buah dia tak buat, adik dia tak buat. So this is you need to see if you are serious enough to eradicate cervical cancer. Of course, the treatment you should know a little bit, because sometimes the patient will ask, okay, you can, but it's not pretty much on the primary care setting. So that's why I not really emphasize in that. But apart from LES, there are many other options nowadays. Kita ada ablation pun yang tak payah remove tissue, right? Just like a burn, like a blade, less problem, less side effects, and less obstetrical problem.